121. What is the best action for a nurse when a patient's incision has a foul odor? Answer: notify the provider and obtain a wound culture. Rationale: a foul odor indicates infection, requiring culture and treatment to prevent sepsis, per CDC wound care guidelines. 122. What should the nurse do when a patient with a PEG tube reports abdominal pain? Answer: stop the feeding and assess for tube displacement or blockage. Rationale: pain may indicate complications, requiring immediate cessation and evaluation, per American Society for Parenteral and Enteral Nutrition, ASPEN, guidelines. 123. What is the priority action for a nurse when a patient's heart rate is 40 beats per minute? Answer: assess for symptoms of bradycardia and prepare for atropine administration. Rationale: severe bradycardia may cause hemodynamic instability, requiring urgent intervention, per AHA standards. 124. What should the nurse do to prevent falls in a patient with impaired vision? Answer: clear the room of obstacles and provide adequate lighting. Rationale: a clear path and lighting reduce fall risk, per Joint Commission Fall Prevention Guidelines. 125. What is the best action for a nurse when a patient's 4 pump alarms for air in the line? Answer: stop the pump and remove air from the tubing. Rationale: air in the line risks embolism, requiring immediate removal to ensure safety, per INS infusion standards. 126. What should the nurse do when a patient with a new colostomy needs dietary advice? Answer: educate about low-residue foods and refer to a dietitian. Rationale: low-residue foods reduce stoma irritation, and dietitian input ensures tailored advice, per WOCN guidelines. 127. What is the priority action for a nurse when a patient's surgical drain is leaking? Answer: secure the drain and notify the provider. Rationale: leakage may indicate dislodgement, requiring immediate correction to prevent complications, per American College of Surgeons, ACS, guidelines. 128. What should the nurse do to promote comfort in a patient with edema? Answer: elevate the affected limb and apply compression as ordered. Rationale: elevation and compression reduce swelling, improving comfort, per ANA Fundamental Care Standards. 129. What is the best action for a nurse when a patient's oxygen saturation is 92% on 2 liters per minute? Answer: monitor closely and assess for respiratory changes. Rationale: a saturation of 92% is borderline, requiring vigilant monitoring for deterioration, per AACN oxygenation standards. 130. What should the nurse do when a patient refuses a bath due to fatigue? Answer: offer a partial bath or postpone until the patient feels rested. Rationale: respecting patient comfort while maintaining hygiene promotes dignity, per ANA Code of Ethics. 131. What is the priority action for a nurse when a patient's blood glucose is 350 milligrams per deciliter? Answer: notify the provider and administer insulin as ordered. Rationale: hyperglycemia requires prompt treatment to prevent ketoacidosis, per American Diabetes Association, ADA, guidelines. 132. What should the nurse do to prevent infection in a patient with a central line? Answer: use sterile technique during dressing changes and scrub the hub before access. Rationale: sterile technique and hub scrubbing prevent bloodstream infections, per CDC Central Line-Associated Bloodstream Infection, CLABSI, guidelines. 133. What is the best action for a nurse when a patient with a cast reports tightness? Answer: assess neurovascular status and notify the provider. Rationale: tightness may indicate compartment syndrome, requiring urgent evaluation, per ANA clinical standards. 134. What should the nurse do when a patient with dementia wanders into unsafe areas? Answer: redirect the patient to a safe area and implement a wander guard system. Rationale: redirection and monitoring ensure safety without restricting autonomy, per Alzheimer's Association guidelines. 135. What is the priority action for a nurse when a patient's NG tube output is bloody? Answer: notify the provider and assess for signs of hemorrhage. Rationale: bloody output suggests gastrointestinal bleeding, requiring immediate evaluation, per ANA clinical standards. 136. What should the nurse do to promote mobility in a patient with arthritis? Answer. Encourage gentle range of motion exercises and provide assistive devices. Rationale. Gentle exercises maintain joint function, and devices support safe mobility, per Arthritis Foundation guidelines. 137. What is the best action for a nurse when a patient's urinary catheter bag is full? Answer. Empty the bag and record the output. Rationale. Emptying prevents backflow and infection, and recording monitors fluid balance, per CDC catheter care guidelines. 138. What should the nurse do when a patient with a terminal illness expresses fear of dying? Answer. Listen empathetically and offer spiritual or palliative care support. Rationale. Empathetic listening and support address emotional needs, per ANA Holistic Care Standards. 139. What is the priority action for a nurse when a patient's incision is gaping? Answer. Notify the provider and apply sterile saline-soaked gauze. Rationale. Gaping suggests dehiscence, requiring urgent surgical evaluation and sterile coverage, per CDC wound care guidelines. 140. What should the nurse do to prevent aspiration in a patient with a tracheostomy during feeding? Answer. Ensure a cuff is inflated and position the patient upright. Rationale. An inflated cuff and upright position prevent food entry into the airway, per AACN tracheostomy care standards. 141. What is the best action for a nurse when a patient's foresight is swollen and painful? Answer. Discontinue the fore and apply a warm compress. Rationale. Swelling and pain indicate infiltration, requiring removal and compress application to reduce swelling, per INS standards. 142. What should the nurse do when a patient with a new ostomy has skin irritation around the stoma? Answer. Clean the area and apply a skin barrier product. Rationale. Cleaning and barriers prevent further irritation and promote healing, per WOCN guidelines. 143. What is the priority action for a nurse when a patient's temperature is 96 degrees Fahrenheit? Answer. Apply warm blankets and assess for hypothermia. Rationale. Hypothermia requires warming to prevent complications like arrhythmia, per AHA standards. 144. What should the nurse do to promote safety during a patient's sponge bath? Answer. Keep the bed at a low height and lock the wheels. Rationale. A low, locked bed prevents falls, ensuring safety, per Joint Commission fall prevention guidelines. 145. What is the best action for a nurse when a patient reports constipation? Answer. Assess bowel history and encourage fiber and fluids. Rationale. Assessment identifies causes and fiber and fluids promote bowel movement, per ANA Fundamental Care Standards. 146. What should the nurse do when a patient with a language barrier needs pain assessment? Answer. Use a pain scale with visual cues and an interpreter. Rationale. Visual scales and interpreters ensure accurate pain assessment, per Joint Commission Pain Management Standards. 147. What is the priority action for a nurse when a patient's pulse is absent during CPR? Answer. Continue chest compressions and follow ACLS protocols. Rationale. Absent pulse requires ongoing CPR to restore circulation, per AHA Advanced Cardiovascular Life Support, ACLS, guidelines. 148. What should the nurse do to prevent skin tears in an elderly patient? Answer. Use gentle handling and apply moisturizer to dry skin. Rationale. Gentle care and hydration reduce skin fragility, per NPIEP Skin Care Guidelines. 149. What is the best action for a nurse when a patient's oxygen cannula causes nasal irritation? Answer. Apply a water-based lubricant and adjust the cannula fit. Rationale. Lubrication and proper fit reduce irritation, ensuring comfort, per AACN oxygenation standards. 150. What should the nurse do when a patient with a feeding tube has residual volume over 250 milliliters? Answer. Hold the feeding and notify the provider. Rationale. High residuals indicate intolerance, requiring evaluation to prevent aspiration, per Aspen Enteral Nutrition Guidelines. 151. What is the priority action for a nurse when a patient's blood pressure is 220/110 mmHg? Answer. Notify the provider immediately and prepare antihypertensive medication. Rationale: severe hypertension risks stroke, requiring urgent treatment, per AHA hypertension guidelines. 152. What should the nurse do to promote dignity during a bedpan procedure? Answer: provide privacy and explain the procedure beforehand. Rationale: privacy and explanation respect patient dignity, per ANA Code of Ethics. 153. What is the best action for a nurse when a patient's wound dressing is loose? Answer: replace the dressing using a septic technique. Rationale: a loose dressing risks contamination, requiring sterile replacement, per CDC wound care guidelines. 154. What should the nurse do when a patient with COPD needs assistance with breathing exercises? Answer: teach pursed lip breathing and provide rest periods. Rationale: pursed lip breathing improves oxygenation, and rest prevents fatigue, per COPD Foundation guidelines. 155. What is the priority action for a nurse when a patient's tracheostomy site is red and swollen? Answer: notify the provider and clean the site with sterile saline. Rationale: redness and swelling suggest infection, requiring immediate evaluation and cleaning, per AACN tracheostomy care standards. 156. What should the nurse do to prevent medication errors during shift change? Answer: perform a double check of medications with the oncoming nurse. Rationale: double checking ensures accuracy, reducing errors, per ISMP medication safety guidelines. 157. What is the best action for a nurse when a patient reports difficulty sleeping? Answer: assess sleep barriers and create a quiet, dark environment. Rationale: identifying barriers and optimizing the environment promote rest, per ANA Fundamental Care Standards. 158. What should the nurse do when a patient with a mobility impairment needs to transfer to a wheelchair? Answer: use a transfer board and assist with proper technique. Rationale: a transfer board and assistance ensure safe, injury-free transfer, per OSHA lifting guidelines. 159. What is the priority action for a nurse when a patient's surgical site is oozing serosanguinous fluid? Answer: reinforce the dressing and monitor for increased drainage. Rationale: serosanguinous drainage is normal but requires monitoring to detect excessive bleeding, per ACS surgical care guidelines. 160. What should the nurse do to promote oral health in a patient with dry mouth? Answer: offer frequent sips of water and sugar-free lozenges. Rationale: hydration and lozenges stimulate saliva, preventing oral infections, per ANA Fundamental Care Standards.